Hi moms, this is Dr. Priyanka Mehta, obstetrician and gynecologist, and I just wanted to share my views in this episode about so many questions that I get about lactation. So today in this video, I'm going to be talking to you about very basic of lactation and what is the importance of lactation or breastfeeding and how much milk is enough. So lactation is a natural process basically that mothers start after the baby is born. In fact, we encourage moms to start lactation, to start feeding as early as half an hour of birth. So within 30 minutes it is encouraged that we do the delayed cord clamping and keep the baby on the mom's chest and start the process of lactation within 30 minutes, and that goes a long way in initiating and continuing the lactation. And where it is not possible, then as soon as possible we try to bring the baby to the mom's breast so that we can start the lactation. Now, even though the lactation is a natural process, sometimes the technique of how you are feeding your baby has to be learned, and new moms do take some time. Sometimes it takes a day or two, sometimes it even takes a week or sometimes even a month. So don't get upset about small things that you're not able to feed your baby or if the milk is not adequate, because nothing is more important than your wish, your desire to feed your baby. And in the initial days sometimes they may need a little bit of top up, but do ensure that when your baby is ready to feed, you are understanding the visual cues in terms of sometimes your baby need not cry when your baby needs milk. So as soon as they wake up, they may start making their faces in a different way. They may just rub their chin, and those are the cues which you have to pick up and start lactating your baby. Also understand that slowly when you are persistent and you don't give up, and it just is a lot of motivation from your side, you will be able to exclusively breastfeed your baby for at least 6 months. Also, the place where you're feeding is so important. So ensure that you are in a comfortable room. It's a nice warm space. You're sitting in a comfortable chair, like a chair with a armrest. You have a good backrest. You can have pillows to support your back. You can have pillows to support your baby as you're holding your baby. There are different positions on holding baby, which I'm not going to be talking to you in detail in this video, but there will be a video coming soon. So you have the football hold, you have the cradle hold, you have the cross cradle. So there are different positions, but try to understand that you have to be comfortable, and each session of feeding sometimes goes up to 30, 40, 45 minutes and even more. So don't sit on the bed without any back support, because as you sit on the bed you just kind of start slouching, and that is not going to be very comfortable for feeding. And if you're not comfortable, you're having neck pain and back pain after some time, that is a negative feedback to your feeding. So the most important thing is that you start with a desire to feed. You tell yourself that you are going to be able to feed your baby. At least assure yourself that this will happen. Sit in a very comfortable space of yours, a private space where you don't have people coming in, going out, telling you different techniques and methods and disturbing you. This is a special time between you and your baby. Look into your baby's face. Think of pleasant thoughts, because even negative thoughts and fear and stress can have a negative impact on your ability to feed your baby. Of course, it is not always possible that you will have fear, you will have anxiety. So share them with your partner, share them with your lactation counselor, share them with your doctor. Understand that whatever is happening, at the end of the day, your intention is that you are able to feed your baby and you're going to be able to take care of your baby. So your space to feed is important. You sit in a comfortable place, hold your baby comfortably, chair with a backrest, armrest, have a footstool to support your feet so that your back is also rested. Do not go and slouch onto the baby, but bring the baby to your chest. So if you're sitting straight, you bring your baby to your chest, have pillows so that you're comfortable, and then start your process of latching your baby. Let the baby search for the nipple, and your latch also needs to be comfortable. Sometimes it takes a few days to learn the proper technique of latching. So seek help for that. When your baby is feeding, it should not be painful. So if it is painful, means your baby is probably just biting onto the nipple. So ensure that nipple and areola both are in your baby's mouth, and slowly as you get the hang of it, you can even in fact sometimes hear the baby as the baby swallows the milk that the baby is getting. One more pertinent question which is asked more by the patient's attenders than, or the mom's attenders, sorry, than the mom herself is the milk enough? So I can tell you, with all the experience I have collected over the years, maybe moms will be satisfied, but grandmoms and so many people who come and advise you may never be satisfied with the amount of milk you are producing. So don't keep checking and rechecking how much milk is being produced. There are very simple 3 or 4 things to understand. If your baby sleeps well, if your baby is doing a good amount of wet diapers, say could be 3 or 4 in a day, or baby can poop either 3 times a day or once in 3 to 4 days, even that is okay, but doesn't strain while pooping, and baby sleeping well, gaining weight, these are the indications that the milk is enough. And if you still have a doubt of the milk being enough or not, don't keep pressing and checking. You do not have to be having milk overflowing out of your breast. You can always pump and you can see how much of milk is collected. So during each feed, actually baby needs not more than 30 to 50 ml, then they take a break. And when you start feeding also, the first milk that comes is the fore milk, as we say, and that is watery, that has more of proteins, and then comes the hind milk, which has more of fats and it is the more thicker milk. So it can take even up to 30, 40 or even sometimes more than that for baby to be fully satisfied. So that is the reason why when you start feeding, be so comfortable that you're not in a hurry to finish the process of feeding. So look forward to it, and slowly you and baby will get hang of each other, will understand each other, and usually after 3 or 4 weeks of struggle, most moms are able to get across it. And still there is a trouble, there are always your doctor, your lactation consultant, also your pediatric doctor. So there are so many people who are there ready to give you professional advice, ready to sit with you, understand where the problem is and take care of this. So don't feel low, try to share the problem that you're having when you're feeding, and happy feeding, and do take care of yourselves.